Hey, those of you online, I just want to update you. We're just waiting for one more board member. I did talk to her and she's going to be here within 5-10 minutes. So then we'll start our meeting. I apologize for the delay. Oh, how long has Sherry been on then?
She's not.
Oh, yeah, she has.
She is.
How long have you been on?
I don't know. I didn't notice. We could have started before. Anyways, I'll call the Richland County and Community and Health Services Standing Committee to order. Can we have roll call, please, sir?
Yes. Miller, Kramer,
Here.
Engel. City of Franco is Williamson, so Williamson. Here. Glassburner,
Here.
McGuire, Barris.
Here.
Brathwaite, and Chicker.
Here.
All right, we have 5 present.
Anyways, are we compliant to the open meeting law?
Yes, Madam Chair, meeting is properly noticed.
Okay, and I will take a motion for approval of agenda. Just to note, we are striking 9D. That was added by accident. So other than that, can I have a motion to approve our 12-point agenda?
I'll make a motion to approve. I'll second.
Thank you. All those in favor, please say aye.
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 Any opposed? And any changes or corrections to the minutes from last month?
That I can see.
Okay, declare those approved and move on to number 6, introduction and review the purpose of the public hearing. So every year we have a public hearing. I'm going to just read these instructions quickly. Anyone present is welcome to address the committee members and staff of the Richland County Health and Human Services. The purpose of this is to solicit comments by the public regarding the services and programs of the Richland County Health and Human Services to assist in the development of our 2026 budget and plan. We ask that each individual wishing to speak would sit in the designated chair at the table, or if they're online, I will call on you. Identify yourselves and your organization you represent, if any. As chair, I reserve the right to limit comments to a certain time period if needed, as determined by the number of those wishing to speak, and the public hearing will conclude when the last member of the public wishing to speak has had an opportunity to do so. So we are going to declare this public hearing open. Is there anyone here from the public who would like to speak? It can be a member of our committee or an employee as well. I think I have to ask 3 times.
3 times.
Okay. Is there anyone here from the public who'd like to speak? Anybody here from the public who wants to speak? All right. If not, I'll declare the public hearing portion of this agenda to be closed. And we will move on to number 8, public comment. Anybody who wants to speak? Okay, no, moving on. 9A, just director admin report.
Sure. So the unit updates are in your packet. Just you can read through the updates from each of the unit managers. Just wanted to touch base on add a few things to that in the Aging and Disability Resource Center. In addition to the programs here listed, the nutrition program obviously continues to go strong. We actually just added a on-call nutrition site worker transportation driver, so we can just make sure that we're continuing services without any delays. Sometimes we have staff call in, so this way the services can continue to be provided without worrying about that. In the behavioral health clinic, again, remains busy. We're getting into grant writing season for a lot of the behavioral health programs, so I just recently had the county administrator give permission to apply for the state opioid response grant, which we've been getting every year since I can remember. So that doesn't come through the board though, because there's no match, we're not asking for new employees or anything like that. So that work continues. A highlight in that unit as well is Emily Shelton, one of our birth to 3 case managers, received a full scholarship from Wisconsin DHS to go to this infant mental health capstone to attend this infant mental health capstone project through the UW-Madison. So we're excited to see what kind of good information she can bring back for the families that are in the birth to 3 program. Child and Youth Services, doing great on reunifications with kids. Had another youth discharge from residential placement, return to parent, which is exciting. And we did have one youth that aged out. In the children's unit, we did just receive a one-time grant also that we are going to use to buy things like, and depending on the situation, not all funding sources allow foster care or any placement families to get certain items. So this grant's going to help us be able to hopefully buy like clothing and diapers and car seats and things like that we don't necessarily get to purchase any other time. Economic support, again, they've met or exceeded all their goals. Public health, they keep on keeping on, busy with loan closet immunizations. They're already scheduling their flu clinics with the schools. We're getting those on the calendar. And then I think updates from me, budget information is coming out. State budget was approved. Very exciting there. Well, I guess better news than we were anticipating. A lot of the cuts that are happening at the federal level, we most of the cuts that they're looking at now are really eligibility related. Not a lot of cuts to administrative dollars, so to speak, which services, it's sad to see some services might end up suffering, but we'll see how that all goes. I think one of the biggest things from the federal level is food share. We receive 50-50 match if we go over our base allocation. They're looking at cutting that 75-25. So obviously, as I'm creating the HHS budget, I'll have to take that into consideration, that that's a possibility. We might see some cuts there. I think otherwise at the state level, everything is pretty much the same. You know, they've agreed to cost to continue, right? They didn't want to, I think they did some of the asks for more funding in some areas. I think they were just like, no, we don't know what's going to happen. So we can't approve additional dollars in that regard. So it was better news than expected. So hopefully I can build a budget that's not too, that's going to be pretty much status quo. And then we just received the budget objectives and guidance from the county administrator. I just got that this morning. So we're going to meet next week, so she can go through that with us. So it's just going to be our standard stuff, like the health insurance increases and the state retirement increases is what we're going to really pretty much stick to that. So that's my report. Oh, one other thing, good news here. I almost forgot this. August 4th, we made an offer to somebody to replace me as business and financial services manager. So we'll see.
So wait,
Cross our fingers.
That's my favorite.
start like that, they would start
August 4th, yeah.
But you haven't heard back yet?
Verbal acceptance of the offer. Yeah, we sent out the offer letter, haven't got that back yet. But
Okay.
it's still a ways out, so where this person was working, they required a month's notice, 30 days notice, so. Anyway, darn, I'll have the budget all done before. But that's okay. But yeah, so. Any questions?
Might be nicer for a new person to not come to
Yes.
the end of the budget process and get one.
I do have a question, and it's mostly because I'm not quite sure how the program works, et cetera. Under Child and Youth Services, you had reported that there was one youth discharged from residential placement with a return home to parent. What generally has been the success rate of that staying that way?
That you staying out?
Staying out of residential care and with the parent?
Oh, geez, I have no idea what the
In other
rates
words,
are.
what is the rate of recidivism?
Ah, that's a great question for Brittany, but she's not here, and I don't know that we've ever tracked recidivism. Have you? Yeah,
It really is situation based.
Yeah, very.
Have some that do very, very well and then some that don't, so it just
Yeah.
depends.
I mean, when I touch base on the placement report later, I mean,
See what the readmit rate is?
well, I don't know.
That's what we call it in healthcare.
Reenact? Yeah, I don't know. And the thing is if even if this one stays with the parents, there's gonna be another one that might come in and mess up the apple cart that way, but
Moving on to 9B, HHS expenditures report. Anything to note? We have that in our packet, so if there's nothing
I reviewed it myself. I don't really see anything that really jumps out. We're starting to order some computers, so we ordered a computer, because we like to rotate that every 5 years, or not replace them like every 5 years is the recommendation. So whenever we get a chance to do that, so we did buy a computer, but we're getting $750 back reimbursement on it. So that's kind of nice. Would be that J comp. Otherwise, those are everything's standard. I even looked at the US bank statement.
Who's the Christopher Kettner, is that Neil's?
That's Mazo Catering, yes.
Okay.
Yeah. Nothing jumps out on the UW or the US Bank one. We did, you'll see a Brooks Publishing kind of number 43, which is $500 some. That's for assessment tools for the Birth to 3 program, and we actually got reimbursed $500 for that. So it was actually like, hey, if you use this tool, we'll give you $500. So that's what we did. Like, well, heck yeah.
Any questions from board members? Okay, we'll move on to 9C, 2025 budget summary and placement report.
Wow. You see it flicker?
Mm-hmm.
Heat. So for the budget summary, current month, which should be the end of May 31st, we should be at about 42% utilization. If you look down through all the different units and programs, the only one that's AOD outpatient is pretty low, but we also had that it was kind of a late hire for that recovery services worker. And then children with disabilities, the CLTS program is pretty high, but that's a program where there's no wait list, and if a child's eligible, they're eligible. And so to guess what we need to budget for that it's a guess truly, depending. I know the core budget balance, if you go all the way down, looks alarming, but I wouldn't be, because I checked, and most of that is the CLTS program revenue. The beginning of the year, the state changed our third-party system for where we do all our billing. We used to go through WPS. Now we go through Gainwell, which is right through Forward Health. There's been some glitches with that, so we haven't been able to do our claiming and draw down our dollars for that. So that's a majority of that is, I mean, if you see we got $125,000 in actual expenses in CLTS, and we've had hardly any revenue come in yet too. So plus I also budget, in this report, I do a prorated levy. But right now, this time of year, we're tapping more into the levy than I necessarily budget or reported here. We did just get a deposit yesterday from almost $250,000 from the state. They hold back some of the funds, just per the contract. They hold it back. They'll pay you for like the first 3 months, but then make you wait 3 months for the next 3 months. So, so that should hopefully fix itself eventually. So.
And the placement report is actually under 9C.
Yeah, so the placement report, for adults, you can see we're at 35% utilization, and the way things are going, we're gonna probably be right at budget come the end of the year. It's an ongoing thing. We had a increase in EDs, and just is what it is. Children's, that's at 41%, again, should be at 42%, under 42%. So this is where the children, I guess we could go in, and of these numbers of the individuals, I could see if any of them were on previous year's reports or whatever, but I don't know off the top of my head. If any of these kids are carryovers from year to year, or if they were on and then off and then back in placement, I don't know. But what's gonna happen is, because of those two youth that aren't placed anymore, you'll note that like the institutional, that'll be 0 out. Knock on wood, no more kids end up in an institution. And then like, and then down, if you look at group homes and treatment foster cares, the one that aged out, so you're gonna see that zeroed out then for the rest of the year for that. I mean, that's not gonna zero out totally, but the cost for the one kid will be out. So that'll be a lot lower. So I see child placements pretty much staying there, knock on wood. So.
Okay, does anyone, any committee member have any questions? Alrighty. No? Short and sweet, any questions on it?
No, nothing.
Future agenda items. So do you think maybe you could kind of update us on where, like, the process is with budget next month, like the budget? Because you said you just received your guidelines.
Just got
Yeah.
guidelines this morning.
So- Okay, perfect.
I mean, I can share that I have to have it turned in by the 18th, so then more than likely I'll bring up at least a summary
Okay,
next month
perfect.
for sure.
Anything else?
I don't know about for future agenda items, but just wondering what the timing and process is for putting it out there, that there will once again be grant applications for the opioids.
Just thinking about that.
That's on me. That's on me. I did ask Trish about that and I have all of the information, so I'm hoping soon, right? I wanted to kind of get through. I just getting ready to certify WIMCR, the cost reporting that I have to do. That's due Monday, so I just got through that. Now I have the budget, so that's on my list to do as soon as possible. I don't know if I'll have anything. Maybe I could get some ads run August so that we can maybe review stuff in September, but October at the latest.
Yeah, because when are they supposed to have it in by?
I think originally twice a year is what they were supposed to do, but Trish missed doing it in the spring before she came over here.
What time of year did we do it? The fall last year, was it?
This was fall last year, yes.
Okay.
Yeah,
Yeah,
Yeah.
so we should probably at least get the notice out so that people.
right. So I don't know that I'll get it out for August. I'll get it out and get applications in for the August.
No, I think, but if we at least notify people, then we could look at them September.
September, October, that's what I'm thinking.
Okay,
I can do it, we can do it for September, but,
okay,
and then
that would be fine.
okay,
Yeah.
we'll shoot for September.
Anything else? For good items? Okay, well, I think our next month's meeting looks like it's on August 7th. My goodness.
We'll be bringing her.
You're thinking,
grant.
you
Her
said,
53
you said August, and I kept thinking that's 2 months away,
No, it's
and
next.
it's not.
She'll,
Oh my gosh.
Her
that's
future, she will have her 53.
Okay,
So you know that.
that'll be on the agenda, okay. So August 7th, normal time, 9:30.
Perfect.
Great. You good, guys? Have a motion to adjourn?
I'll make a motion to adjourn. I'll make.
Thank you, everyone.
All those in favor, please say aye. Opposed? Thank you all for coming. It's a busy time of year, so I appreciate it. Enjoy the rest of your summer.